So, I am 5 weeks post-op, and I am very proud. Yay! I feel like probably the biggest things that have changed now in these last 2 weeks have been my speech majorly improving. I feel like I sound kind of a semblance of my old self, how I used to speak, and I think that's come from doing myofunctional therapy and also increasing my mouth opening and just getting used to, you know, my new space and where everything's positioned. So that's been really great, and reduced swelling too. I'm still kind of numb, like around here and my chin in different places, and there's a middle part of my lips too that's just kind of staying numb. And I know that'll last a while, but overall, I think week to week, maybe now every 2 to 3 weeks, I'm seeing improvements with numbness and getting feeling back. Probably the most annoying still is my upper teeth. I can't really feel, and my palate, I still can't really feel that well. So I'm going to try and make these videos a little shorter and not go over everything that I've shared in my blog post, and instead just do like a visual of speech and swallowing and exercises I'm doing, because I think that'll be a little bit more helpful for people who are considering this surgery. So one of the biggest exercises I'm doing now is mouth opening exercises. So I was cleared for soft chew diet at 4 weeks. It was awesome. It was awkward. Felt like robot jaw, but I feel like I've gotten a lot better, and it just takes time to kind of learn your new joints and not having like the side to side movement as much, but your body adapts, and now it feels like, I guess I've always been chewing this way, so that is good news. So one of the main mouth opening exercises I've been doing is with popsicle sticks. And I just stick them, and I just take them out. And I added this popsicle stick about 2 days ago, so every 2 to 3 days I'm adding a new popsicle stick, which is about 1 millimeter. And I think at first, progress with mouth opening, you see a lot of progress at first, but then it probably will slow down later on, so I'm expecting to not be too disappointed when I get up to 30 if I'm not having a new one of these like every few days, instead maybe once a week or something like that. Sometimes I also do it like this. And like there's pain when I do that in the joints. It's stretching the muscle, it's stretching everything. So you don't want to do it to where it's like incredibly painful, but you want to feel a little bit of pain to have that stretch. But don't overdo it, kind of listen to your body, but you need to stretch it out. That's how you get your mouth opening back. So I think my mouth opening is about 20 millimeters at this point. You put this actually just on one of your bottom teeth. So yeah, that's how I measure. Swallowing has also gotten a lot better. I've been practicing the correct swallow, which is making sure that you can suction all of the water or food or whatever you have in the back of your mouth and be able to kind of turn over, and it shouldn't be able to fall out, and then being able to swallow while smiling. So it sounds weird, but it has taught me how to correctly swallow again. And I was able to swallow just then while smiling. And that's the correct swallow. So if muscles have flared up and I'm having kind of a bad muscular day, I just go back to smiling while I swallow. It's not a positivity thing. It's actually an exercise. I'm not happy. And also eating's gotten a lot easier because I can fit a spoon in my mouth now. This is just some pudding. Correct swallow. Some other exercises I've been doing from the myofunctional therapists have really helped too. Namely, after all the swelling's kind of gone down, I still have a problem with my lips not meeting up. So that is just a byproduct of years and years of them not meeting and this muscle not being trained to kind of close my lips. So that's gotten shorter. So one of the things I've been using from my myofunctional therapist is this little device. And what you do is you just fit it in your mouth, and you have to work your lip muscles to hold it in place because it starts wanting to tilt from side to side. And it's also just a good workout. Like, I feel all of these muscles getting really sore. So put that in. And that's kind of it. And I just sit there with it for 10 minutes. I try and do 2 times a day. I really should be doing like 3 times a day. Another exercise is just with these soft tubes, just to build back muscles that have atrophied just from disuse from all the years and time not chewing, and especially recovering not chewing. Kind of just gently exercising those. Just like that. And then another one I've been doing too, just to work on better tongue placement, working out all the muscles, just trying to get back to normal, is putting a rubber band on the tip of my tongue. And then I do a pickle tongue in the front, and then I also do the tongue and touch the palate. Other myofunctional exercises I've been working on too to strengthen the muscles around here is the front kiss and side kiss, and that is pretty hard to do, the side kisses. So the front kiss, right now I can kind of do that. Side kiss, trying to go this way. So I can't move my jaw side to side anymore. So that's kind of, I don't know if that's going to go back to normal, but it's just an exercise. I really don't need to be like kissing side to side. Also, smile update. Still a little tight, but getting back to normal. And finally, a scar update. My scars usually, I think, stay darker for a while, so nothing's really changed too much, I feel like, in the past, few weeks. I've been using silicone patches, just some ones I bought off Amazon, and they've been working pretty good, but I imagine this discoloration will last for a while. And then these muscles have gotten really tight too. That go from here to here. So that's where I was having some trouble swallowing on the 4th week too, is those muscles were just not doing the right thing. So I've been having those also massaged by my craniofacial PT when she does the lymphatic drainage and tries to move everything down. So I think that's been helping too on swallowing. But yeah, that's my 4 to 5 week post-op update, and I'm quickly approaching 6 weeks post-op. I'm still trying to manage muscular pain with Klonopin so that, all the muscles don't start freaking out. And I actually like that a lot better than my pain medicine at this point. I rarely have to take pain medicine now, but some days if I overdo it, I'll need to take the pain medicine. But still, my pain levels are, I'd say, a lot lower than pre-op levels. Which is really great. And I'm still just trying to take it slow and not go super fast, because again, my brain feels like I'm ready to do all these things, but my body is still weak. I'm thinking about maybe starting gentle exercises again. And then my next appointment with my surgeon will be next week on Thursday, and that's when I get the TADs. You can see that nice TAD there. This one that's totally covered in tissue, and the other 2 right here are removed. And then he's gonna make a small T-shaped incision where my Le Fort was made and try and reposition the septum. If you can see, it's still pretty deviated, but the swelling's gone down, so I can breathe about like 50% through here, but allergies have been terrible, so I had a lot of pressure build up today in the Le Fort area, and I think that's a big reason I had to take pain medicine too, because everything just kind of started radiating and hurting. Also, I'm trying different things with my video setup. I'm a photographer part-time, so I really enjoy setting up things, and I'm getting more into videography because it's been more enjoyable, and I've had a lot of fun making these. So yeah, thanks for watching, and let me know if you have any questions in the comments. Reach out to me personally. I love helping people work through their, TMJ journeys, and, if you're considering TJR, I'm open for questions, so thanks.